a whole genre of products, just like your fitness band, that continuously monitor whether it's your oxygen level, your blood pressure, your blood sugar, and report it not just to you, but to your doctor. Some of the most phenomenal things that happened was that there's a digital thermometer from a company called Kinsa, and they could spot COVID outbreaks before anybody else could, based on seeing temperature elevations in geographic regions. So in San Francisco, the mean temperature was going up of all their users, and they knew that it would be a hotspot for COVID. So post-COVID, they're going to take all this information, and a doctor doesn't care that you walk 2 miles every day or that this is what your blood pressure is, but they do care if there's a sudden change, if there's a dramatic fluctuation in something, and they can get alerted. We will start to be able to give permissions in this world of telehealth to say, here, doc, here's my whole watch, take everything from it. And if my blood pressure goes berserk, give me a call. And so health will change. We will be much more responsible for it, but we will also have the data to make really good decisions about everything, calorie intake, and some of the other.
Go ahead.
Remember the one, the Medio? You just look into a camera. Thanks to visual computer imaging, it can see the blood going through your face and see if you're having a respiratory problem. That's how precise and exact these technologies are getting. So you don't have to wire yourself up to something. You can just look in your camera, and your camera can tell you, your eyes are jaundiced today. Imagine going to your mirror in the morning, which is going to happen soon, and your mirror will be able to tell you, your skin's not looking so good today. You look like you might have a little jaundice. You might need vitamin D. You might need vitamin B. So this personalization of all things health is, we laugh that if you walk into a Best Buy now, the digital health part of the shelves,
the biggest part. It's
exactly.
huge.
CVS, Walmart. I mean, they're all embracing this idea of self-monitoring, and partly because of partly because of the pandemic, but partly because of our health system. We have learned as consumers that we have to be our own best advocate and caretaker.
Yeah, I mean, we used to talk about advocate. That was only something that happened, post-surgery or something, that you had to have someone there. And I think what we're learning is this constant monitoring is valuable. It's more valuable than just a one-time doctor's visit.
That's right.
To, take your blood pressure right then and there. What about your blood pressure when you're, flying on a plane, or when you're, carrying something heavy up the stairs, or all of these kinds of things?
Yeah. So we say the trend is from intermittent healthcare, I go to the doctor once a year, to continuous